So cardiac electrical impulses from it is stimulated from SA node to AV node to bundle of the Purkinje fiber, entire ventricles. Here there is some delay. It is due to heart block, namely type 1, type 2, type 3. There are some prolongation, continued prolongation, and skipped beat, and also 4:1 prolongation or rest beat. It is called as heart block. Hello all, good evening. This is Kavipriya, lecturer from the Department of Cardiac Technology. Now I would like to give a lecture classes about heart block.
So I'd like to reiterate on the definition and what heart block basically is. Like my mom said, heart block refers to a delay or complete interruption in the electrical conduction system of the heart, mainly at the level of the atrioventricular, which is the AV node, or below it. Normally, impulses start from the SA node, travel through the atria, reach the AV node, and then pass to the ventricles via the Purkinje system or at the bundle of His. In the heart block, this conduction pathway is slowed or blocked, leading to an abnormal heart rhythm.
So the heart block, which is refers to delay or block. Okay, blocking some impulse conductions from SA node and to the AV node. In between, some internodal fibers are there. Any interruptions, maybe due to dilatations or valvular disease, it gets delayed. So it is referred as heart block. There are 3 types of heart blocks are there. Okay.
So now I'll elaborate on the first degree heart block. So first degree AV block is a condition where there is delayed conduction through the AV node, but all impulses are conducted to the ventricles. So nothing here is actually blocked. There is only a delay in the conduction. It is not completely blocked. So in this condition, the AV node conduction is prolonged. Every atrial impulse still reaches the ventricles, and there is no drop beat here that occurs here. So this happens due to increased vagal tone, AV nodal delay, or mild conduction delays that might occur in the region. And the ECG criteria for such is the main hallmark sign for this is prolonged PR interval. So the normal duration of PR interval is anywhere in 0.2 seconds. But in this condition, since there is a delay here, the hallmark sign would be the prolongation of the PR interval, meaning the duration would be over 0.2 seconds.
So first degree heart block, normal duration is about 0.18 to 0.20 second. At most within 0.25 second is also considered as normal PR interval duration. But here there is maybe increased duration, that is PR interval is prolonged up to 0.25272935 up to. So these prolongation only in common prolongation in all the leads which resembles first degree heart block. If any prolongation which leads to another degree heart block, let's discuss about it.
So I'll explain the pathophysiology of this step by step as well. So in a normal heart, the AV node acts like a gatekeeper, allowing impulses from the atria to reach the ventricles in a controlled manner. So in heart block, one of these 3 things happens, which will be either the impulse is delayed, or some impulses are intermittently blocked, or all impulses are blocked completely. So this might occur due to either damage or dysfunction of the AV node or the conduction pathways. Or it can occur due to reduced blood supply, which is ischemia, or it could occur due to structural degeneration or fibrosis.
So it is maybe occur due to majorly 3 differences. Accordingly, ischemia or structural abnormalities or fibrosis, degenerative disease at all. Okay.
So like I said, there are 3 different causes, one of which is cardiac causes. It will involve myocardial infarction, especially in the inferior wall. It will also involve ischemic heart diseases, degenerative changes like aging related fibrosis, cardiomyopathy and myocarditis. There are also drug-induced causes which involves dosage of beta blockers, calcium channel blockers, digoxin or any antiarrhythmic drugs. As an adverse effect of these drugs, you might get a heart block. And other include metabolic or systemic causes. This includes electrolytic imbalance, especially with hyperkalemia, hypothyroidism, infections like Lyme disease, and also infiltrative diseases like sarcoidosis and amyloidosis.
These are the major causes which may cause all these types of heart blocks. Okay.
So because of these causes, the ventricles may receive fewer impulses, leading to bradycardia. In severe cases, the ventricles generate their own escape rhythm, which is slow and inefficient. This results in reduced cardiac output, causing symptoms like dizziness or syncope. Now there are different causes of heart blocks or why it occurs or due to what it occurs. It is classified into 3 causes: cardiac related causes, drug induced causes and metabolic causes.
Delay may cause syncope, dizziness, and majorly it leads to, even it maybe leads to heart failure, sudden arrest also. Okay,